Hello, I'm Congressman Mike Kaufman, and I'm here in support of MCPN's Bridges to Care program. It is a federally funded, innovative approach to healthcare management that has substantially reduced healthcare costs. And I want to salute the 500 individuals that have completed the Bridges to Care program and urge my elected colleagues across the country to take a look at the Bridges to Care program as a model for healthcare reform.
A regular day for me was just full of pain. I was so full of pain and anxiety because of the pain, so I'd have to keep going to the hospital, emergency room, over and over again.
A very difficult and problematic time with my diabetes. Was not able to really or soundly control my health.
It was when I had an ER visit after, let's see here, I was prescribed tramadol, and after taking my first dose, I can't really explain it. It kind of really messed me up.
Bridges to Care is a CMMI-funded program through Rutgers University that really focuses on the why. Why do patients end up in the emergency room? What triggers that visit, and how do patients really become high utilizers? B2C is not just a clinical intervention, it's more of a community intervention, as high hospital utilization and high healthcare costs are more of a community issue. Our work through Bridges to Care is done in collaboration with partners. We partner closely with University Hospital, Together Colorado, Aurora Health Access, and Aurora Mental Health. But the most important partner in this venture is really the patient.
Initially, patients start out in Bridges to Care and they are enrolled into the program. They're asked to participate in a 60-day model. We visit with the patients in the homes. The initial appointment is set up where the care coordinator and sometimes the behavioral health provider or a health coach will go into the home. They'll meet with the patient. They'll do a needs assessment to find out what those needs are. And once they figure out what's going on with that patient, what's kind of driving those ER visits, what other underlying issues there are, then they at that point develop what that plan looks like over the next 60 days.
When MCPN was first talking about bringing the Bridges to Care program to life, we definitely wanted to include behavioral health. What we had found out through our accountable care program that we have here is that up to 80% of our patients do experience a behavioral health issue. So when we were developing the Bridges to Care program, we wanted to make sure that the behavioral health needs of our patients were addressed. With that, we also knew that we would ask Aurora Mental Health to participate with us to be able to provide that behavioral health support. Since that time, our partnership with Aurora Mental Health in providing both psychiatric support, behavioral health, and case management support to our patients who have behavioral health needs has been absolutely essential to the care that we provide.
We had a psychiatric nurse practitioner
who was meeting with individuals and following them with medications, in addition to behavioral health providers who are integrated into part of the team, and we're working with folks in a brief setting to meet their behavioral health needs, whether that be case management needs, individual psychiatric conditions that we're working with, and then if longer therapies are indicated, then triaging them into the mental health center for those services as well.
They have really helped me with a lot. On my weight problem, I have lost about 40 pounds since I've been here, and they've been helping me with everything, my blood pressures and everything that's been sick. I'm walking better. I'm doing more for myself better. They're great over here in this program.
Bridges to Care staff work pretty diligently to address patients' underlying problems that are driving them to the emergency room. That can be a variety of things: lack of transportation, perhaps they got evicted from their home, untreated behavioral health needs, maybe grieving the loss of a loved one, or even lack of insurance.
It was because I think it was because I was stressing because I had lost my big sister. I consider her as my best friend. Okay, she had died and me and her was real close, and it's just like, I don't know. To talk about her makes me sad because that's my best friend. And it took a toll on me to the point that I just couldn't handle it no more. It caused me to have a heart attack.
Through having an effective multidisciplinary approach, we've really been able to have a lot of successes to date. We have had a dramatic decrease in the number of ED visits at 50%. Also with our hospital admissions, a reduction of 54%. The number of visits with patients with chronic pain, we saw 43% reduction. Another thing that we've examined with the program is ambulatory care sensitive conditions. They've also gone down after enrollment by 35%. The reduction in visits for those with mental health comorbidities went down by 34%. So across the board, we're seeing reduction in a variety of areas. Most importantly, though, is the significant cost savings that we've seen. To date, we've enrolled 500 patients in the Bridges to Care program. When looking at just under 100 of those patients, we saw a $2.2 million savings just for 96 patients alone. That equates to a per person savings of $22,000. Of goals with the Bridges to Care program. Of course, we want to definitely decrease hospital utilization. We want to, show cost savings. But there's other goals that we have in mind as well. One being linking patients into primary care at MCPN as their medical home. At the end of the program, our graduation percentage is 100% of patients are finally linked into primary care upon graduating from the program. We also like to provide resources and assist patients in what benefits they may be eligible for, provide medication reconciliation after a hospital stay, finally recognize and treat behavioral health concerns, and really empower patients to navigate sometimes a very confusing and overwhelming healthcare system. The Bridges to Care team shares the philosophy of encouraging patients to be more of a participant in the healthcare system as opposed to being a recipient.
Now I'm wanting to go out and do things the best that I can, as much as I can, which is better and better every day. My days have gotten better and fuller.
I definitely feel less overwhelmed. Like if I need care for something, I'm able to get it. Especially since I'm taking care of my dad with his cancer and everything, so and being able to have these home visits makes it a lot easier to get my appointments scheduled in around all of his.
It was just a humbling experience to me. They were real nice people. They came to me, anything I wanted to know, they answered the questions for me. And anything that I wanted to know, if they didn't know, they found out for me. And to me, that means a lot when you don't know.
It has really benefited me personally, I think, a lot more than I could have ever imagined. I was at a kind of crossroads of my life will definitely change, and it can either be for the worse or for the absolute better. And just the connections I've had with a number of individuals with this program has kind of certified a immense change for the better. It really has, physically, mentally, and just spiritually and everything. So
in this proud land we grew up strong. We were wanted all along.